One of the restorative procedures that we frequently do in dentistry is to place what's called a crown, patients sometimes call them a cap, on a tooth. The reason that we do that are teeth that have fractured, they have severe decay, or they've had a root canal, or the patient has ground them down where there's practically no tooth left. And the way that we restore a tooth with the crown, first of all, we anesthetize the tooth. Then we go in and we gently reshape the tooth where it's a slightly smaller version of the way it was before we did that. Then we take an impression of that, we send the impression off to a dental laboratory, and they fabricate the crown, and basically the crown slides down over that reshaped tooth and restores it to its original size and shape, and it's then cemented into place. And one of the significant advantages to that is it helps prevent that tooth from fracturing in the future. It also restores it where the patient can chew with it better, and cosmetically it can significantly improve the appearance. There are several different types of crowns that are available to us now. Originally, crowns were almost all just gold. We still do gold crowns in some cases, obviously for cosmetic reasons. We do those primarily on the very back teeth. We also have what's called porcelain fused to metal, and that's a metal core that slides over the tooth, but it's covered with porcelain. So now it does not look like a metal crown any longer. It looks like a natural tooth. And then there are also crowns that are purely made out of tooth-colored material. Originally those were just porcelain. Now we've got some tooth-colored materials that are much harder and stronger than porcelain. We'll use those on back teeth, typically porcelain teeth because they are much prettier. We'll use those on the front teeth to restore and improve smiles. When we make a crown, again, we reshape the tooth, make it a smaller version of itself. We take an impression of that, we send that to the laboratory, but we don't send the patient home with a modified tooth without any covering. We place what's called a temporary crown on the reshaped tooth. The temporary crown is made out of tooth-colored plastic, so the patient's appearance is not marred during that time. It takes typically 2 to 3 weeks for the laboratory to fabricate a crown in our office, and so the patient returns at that point. We remove the temporary crown. We take the permanent crown and check its fit. We use both x-rays and visual examination to make sure that it fits properly, that the bite is correct, and then once we're satisfied with that, we apply cement and cement the crown in. Crowns afford us the ability to make some major modifications as necessary. One of the significant improvements we make in a regular situation is to take teeth that are discolored, they're chipped, they're slightly crooked, particularly front teeth now I'm talking about, and we can reshape those teeth in such a manner that when the crowns are placed, we go from a compromised smile to a beautiful smile. Another thing that we do with crowns, and this is in major cases where people have had problems with their joint, they've worn all of their teeth down, they've got significant bite issues where their teeth just don't align like they should. We can go in and actually rehabilitate the entire mouth by using crowns. It gives us the ability to actually completely restore function to patients that are in distress with the way their teeth bite together.